Here with me now is physician Dr. Devi. Devi, I want to welcome you to the program. It's always good to have you here. We also want to ask you first, I want to play you some sound because President Trump's latest executive order eliminates the COVID-19 vaccine mandate from schools. We've been talking about this. So first, let me ask you, is this a concern that you have as a physician?
Well, there's so much controversy. The country is divided about the vaccine, right? Some people are still very concerned about COVID. Some people are very concerned about the vaccine. So I think if we don't have the mandate, people can choose which way they want to go. If they want to be vaccinated, they can. If they don't, then they have that option. So I think that is, you know, he's fulfilling his campaign promise.
Sure, but what are you hearing from the people that you see and you talk to in your medical community?
Yeah, so in the medical community, that too, there's some division about it, but generally speaking, COVID has become less of a threat. We're not seeing the same situation that we did back in 2020 where people are hospitalized, nobody knows what to do. Now we have more effective treatments, you know, the lockdowns are over, so I think that this will go over more smoothly. I think there is more controversy maybe because of the federal funding question, but as a practical matter, it may not affect too many universities.
You know, RFK Jr., the newly confirmed Secretary of Health, has been highly critical of vaccines, as we know, and the health of Americans. Here's what he had to say. Let's talk on the other side.
We literally have the sickest population in the world. Those are the people that got us there. We do need a break. We need somebody different who can come in and say, I'm going to be a disruptor. I'm not going to let the food industry and the pharmaceutical industry run health policy anymore.
So what do you say to that? I mean, he has said that America is the sickest population in the world. Do you agree?
To some extent, I do. I mean, if you look at the amount of money that we spend on healthcare, we should have a lot better outcomes. But on the other hand, the sickest people come here because we have amazing healthcare options, right? So, you know, there's two ways to look at it. But on the other hand, just broadly looking at healthcare, you know, what are we trying to accomplish? We want to live longer, and we want to have healthier lives where we can accomplish more, better quality of life. So that goes beyond vaccines. You know, we should be looking at all the things that we have available to us, all this genetic testing that we can do, AI, you know, which is now going to be used like through Stargate to try to find better treatment and possibly a cure for different cancers. So there's a lot more that can be done with this kind of attitude that we don't have to follow the traditional thinking.
Right, a lot has changed over the last few years, so we'll see what the new year brings us. We appreciate your time as always and your perspective, Dr. Devi. Thank you.
Thank you.